Namaste, myself Name-Shivi Saxena, Faculty of Physiotherapy and Diagnostics, and my discipline is Medical Laboratory Technology from Jayoti Vidyapeeth Women's University, Jaipur. So welcome and digital version 2.0. So let's my today topic is Trichomonas. So start my topic. Firstly, introduction of Trichomonas. So first classification. Domain, Eukarya, Kingdom, Protista, Phylum, Monada, Class, Paravasilia, Family, Trichomonadia, Genus, Trichomonas, and Species explained in this session. So, Trichomonas vaginalis. So, start. So, firstly, general properties. Characteristically have a cytostome and anterior tuft to flagella, undeviating membrane with the recurrent flagellum, and exostyle producing through the posterior end, only trophozoite stage. Genus Trichomonas so is the simplest of the protozoa parasites. So members of this genus affect not only pupil but predatory and other farm animals. So genus Trichomonas has three species which occurs in human. First, Trichomonas vaginalis. Second, Trichomonas hominis. And third, Trichomonas tenax. So, Trichomonas vaginalis, found in vagina, urethra, and protestum, infection is pathogenic. Trichomonas tenax, found in oral cavity, occurring particularly in dental cavities and at its gingival margins, and infection is non-pathogenic. And third, Pentatrichomonas hominis or Trichomonas hominis. So found in lower GI tract, particularly in synonym and not pathogenic. Trichomonas vaginalis. So important species which causes infection in both male and female. So is the causative agent of trichomonas monasis. Infection is sexually transmitted. In 1837, Turner first observed the flagellate, and in an anaerobic organism produce energy by fermentation of sugars in a structure called hydrogenosome. In modified mitochondria, in which the enzyme of oxidative phosphorylation has been replaced by enzyme carrying out anaerobic fermentation. So, morphology exists only in trophozoite stage. Cystatic stage is absent. So, trophozoite is a pear-shaped and measures 7 to 23 micrometer in length and twitch motility. 4 anterior free flagella arising from a shallow depression in the anterior end of the body called periflagellar canal. Okay, and fifth flagellum curved back along the margin of the undulating membrane and is called the recurrent flagellum. And costa is the rigid cord filamentous and support to the undulating membrane. And exostyle is a hyaline rod-like structure that run through the center of the body and come out at the posterior end. The exostyle is a part of the endoskeleton, and the cytoplasm contains a large number of cytophilic granules and sometimes viral particle. And mode of the transmission. So trophozoite cannot survive outside, and so infection has to be transmitted directly from person to person. And sexual transmission is the usual mode of transmission. And trichomonasis often coexists with other sexually transmitted diseases like candidiasis, gonorrhea, syphilis, or human immunodeficiency virus, that means HIV. Babies may get infected during birth, and fomites such as towel have been implicated in transmission. So trophozoites divided by a binary fission and incubation period is roughly 10 days. So life cycle is a trichomonas, and mention this share in this screen. Uh, So life cycle is simple and is completed in single host. Infection is transmitted sexually from a woman, acting as a reversible of infection to men. In female, the parasites get nourishment from the mucosal surface of the vagina and from the ingested bacteria and erythrocytes. So reproduced by longitudinal binary fission. It begins by a division of the nucleus followed by the division of the neuromotor apparatus and finally separation of cytoplasm into two daughter trophozoites. On sexual contact, trophozoites are transmitted to male and localized in the urethra and prostate gland. Multiplies when vaginal condition become more basic than usually normal pH 3.8 to 4.2. So complete this cycle, and next virulence factor. So protein, lipid, and protease help in adherence of trophozoites to epithelial cells of the GI tract. And second, lactic and acetic acid. So lower the pH of the vaginal fluid. Low pH of vaginal pH is cytotoxic to epithelial cells. And third, enzyme cysteine protease. So responsible for hemolytic activity of the parasites. And next, clinical manifestations. So first, STI, and second, common causes of vaginitis in women and urethritis in men. Trichomonasis present a wide variety of clinical pattern. The spectrum of clinical trichomonasis is in women ranges from the asymptomatic carrier state of flagrant vaginitis with but one half one and third of the asymptomatic affected patient becoming symptomatic within 6 months. And uh, women in symptomatic vulvovaginitis, that means vaginitis and urethritis. So, and in man, asymptomatic. So, erythritis and epididymis and prostatitis and superficial panel ulceration. Second, irritation inside the penis, mild discharge. Discharge may be prevalent to mucoid or slight burning after urination, and mostly self-limiting trichomonal action of the prostatic fluid or flushing out of the flagellate during menstruation. And complications: PID and premature birth, low birth weight, increased risk of transmission of HIV, and increased chance of cervical cancer, and may also cause pneumonia, bronchitis, and oralism. And in men, so prostatitis and erythral stricture and infertility. And epidemiology, most common non-viral sexual transmitted disease, and an estimated 200 million women suffer from trichomoniasis every year worldwide. And prevalence of trichomoniasis varies between 5% in patient at hospital to 75% in sexual worker. And geographical distribution. So world prevalent land worldwide and high prevalence of infection, even up to 65% has been documented in pregnant women in South Africa, and the condition is also prevalent in the Europe, the USA, and other developed country. So, specimen collect in laboratory diagnosis. So, in women, vaginal discharge and endocervical specimen, and in women, prostatic fluid and less commonly semen. And common specimens in urethral swab, early morning first voided urine sediment. So laboratory diagnosis. Firstly, microscopy, culture, antigen detection in vagina, smears, and molecular diagnosis, and last, other tests. So firstly, microscope. Trichomonas in the vaginal discharge can be demonstrated by first red mount, second actinic orange staining, and papinular stain, that means pap smear, and fourth direct fluorescent antibody staining, that means DFA. So vaginal or urethral discharge is examined microscopically in saline bed mount preparation for characteristic jerky and twitching motility and shape. In male trophozoites may be found in urine or prostatic secretions. Next, fixed smear may be stained with actinic orange and pap stain. And next, DFA is more sensitive. Okay. Second, culture. Considered as gold standard for the diagnosis and is recommended when direct microscopy is negative, and is considered as gold standard as well as the most sensitive, that means 95%, and method more for the diagnosis of trichomonas vaginalis infection. Grow whereas the 35 to 37 degrees Celsius under anaerobic condition. Okay, the optimal pH for growth is 5.5 to 6. Can be grown in a variety of solid or liquid media and tissue culture and eggs. And cystine, peptone, liver, maltose, that means CPLM, medium, and plastic envelope medium, that means PEM, are often used. Third, antigen detection in vaginal smear. So ELISA is used for demonstration of Trichomonas antigen in vaginal specimens. ELISA using a monoclonal antibody specific for a 65A DA surface polypeptide or Trichomonas vaginalis is a very specific and sensitive method for detection of parasite in vaginal secretion. Fourth, molecular diagnosis. So, DNA probes, synthetic oligonucleotide probes, and PCR, highly sensitive, that means 97%, and specific 98% test for the diagnosis of Trichomonas vaginalis. So treatment, final step. So stimulatious treatment of both pattern is recommended. So metronidazole 2 gram orally as a single dose of 25 mg 3 times daily for 7 days. And metronidazole is contraindicated in pregnancy due to is mutagenicity. So topical therapy with clotrimazole is applied. Okay. In patient not responding to treatment with standard reason. So the doses may be increased and metronidazole may be administered parenterally and metronidazole may be administered both in the oral and vaginal routes. So prevention and control. So safe sexual behavior and avoidance of multiple partners. So use of condom, detection and treatment of cases either male or female. So this session is completed and any query mentioned in comments box. So thank you and namaste.